Hey guys, I'm Ben, I'm a PA, and in this video I'm going to share 5 advantages of being a PA over being a physician or a doctor. So I've been working as a PA for almost a decade now, and I've worked with tons of doctors, so I have a pretty good perspective on both sides. So I'll share these 5 advantages, 5 things that make it actually better being a PA than being a doctor. And that doesn't mean it is better overall necessarily. You can look at all the risks and benefits, the pros and cons, but these are 5 advantages of being a PA. So the first one is flexibility or versatility. One of the big advantages of being a PA is that you can pretty much work in any specialty and you can switch specialties. So for example, when I first graduated, I worked in the emergency room, and then simultaneously I worked in family practice. Those are 2 different specialties. Doctors don't usually do that. And then if I wanted to, I could go out there and look for a job in dermatology or orthopedics. Now granted, there'd be a learning curve and all that, but if I really wanted to, I could do that. But as a physician or a doctor, once you finish medical school, you go do a residency and then sometimes with something like a fellowship or whatever. So there's several years after medical school, they do their training and then they're kind of locked in to whatever their specialty is, more or less, because they would have to go back and do another 3 to 5 year residency or something along those lines to be able to enter a new specialty. They can't just go find a job. So for example, the doctors I work with in the ER can't just go find a job in dermatology. Well, I don't think so, or certainly not in like orthopedics, because it would require a lot of extra training for them to become an orthopedic surgeon. So they'd have to go back and do like 5 or 7 years or something of additional training to do that. So overall, PAs, we have a lot more job and specialty flexibility. So number 2, here's advantage number 2, and it's on a related note, and that is that the training and education to become a PA is shorter. It's quicker. So basically, both of us go to undergraduate for 4 years. We go to college, we get a bachelor's degree, but then you either go to PA school or medical school, and medical school lasts 4 years, PA school lasts 2 or 3 years. So we're already a little bit shorter, but then the biggest difference is they go out and do that residency and then sometimes additional training like a fellowship afterwards. So ultimately, after high school, our path is like 7 years or something, and their path is at least 11 years, generally speaking, but often much longer. So it's certainly quicker to become a PA if you're starting from scratch. So that's one of the advantages of being a PA is you can get there more quickly. So here's advantage number 3, and this is actually closely related to the one that I just said, and that's simply the fact that we don't have to do a residency at all. Because residencies, not only does it take extra years, but it's also generally kind of miserable just because you're like super busy. You're kind of doing all the grunt work in the hospital, especially that first year of residency called the intern year. Residencies are known for not being a fun part of life. I mean, fun in the sense that you're busy and you're learning a lot, but certainly not fun in the sense of having free time and being able to do what you want with your life. So just not having to even bother with the residency is a big advantage of being a PA. And that's part of the reason our education and training is shorter. And it's also part of the reason why we have that job flexibility that I mentioned at the beginning. So another advantage of being a PA is that sometimes in some situations you have less responsibility. In other words, like less weight on your shoulders. Certainly not all the time, because a lot of times we do exactly the same thing as the doctors. Like when I was in family practice, I did 98% of everything the doctors did. The only difference there was when they had to sign a form or something, basically. Doctor's signature. Doesn't say PA's signature, so I guess I'll have the doctor sign it, right? But mostly we just did the same job. But I can imagine, for example, a surgeon, let's say an orthopedic surgeon, just for the sake of argument, they're going to kind of have more responsibility than the PA that works with them, because ultimately the surgeon is the one who's responsible for the surgery and doing probably the majority of the surgery. But another example would be in the emergency room where I work. The patients who are the most gravely ill are often seen or taken care of mostly by the physicians. And that includes somebody, say they had a cardiac arrest, meaning their heart stopped, or they had a stroke, or their blood pressure's dropping really fast and we're worried they're going to die or something. Then usually the physician is there at the bedside kind of taking on, the bulk of the responsibility for that patient. And so in some ways, as a PA, I do all those same things. I take care of very sick patients, patients with very serious problems and so forth. But the doctors spend a little bit more time doing that on average. And so ultimately they kind of have more weight on their shoulders. So the fifth advantage of being a PA over being a doctor is that you may have less paperwork to do. So I alluded to that already, that sometimes there are forms that doctors have to sign or doctors have to fill out. Now, in real life, of course, maybe I fill out the form and then just hand it to them to sign, or in a clinic, their staff probably helps them a lot of times fill out the form and then the doctor just signs it or something like that. But there is a lot of paperwork that the doctor is supposed to be filling out or signing or what have you. And then another angle on that is continuing education requirements, because we have a lot of continuing education requirements. Doctors have a lot of continuing education requirements. But I've noticed, at least in Nevada, I've noticed that there are a few additional specific requirements that they put on the doctors that they don't put on us for whatever reason. And so they spend a little more time dealing with that, the paperwork associated with that and the time that goes into taking those classes and, passing the quiz at the end and getting the certificate and blah, 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 blah. So there can be more paperwork as a physician sometimes compared with a PA. So those are 5 advantages of being a PA over being a doctor. And if you want to compare PAs with something that's a little more similar, which is nurse practitioners, I've got a video right here that kind of does a detailed comparison and some of the pros and cons, or what are the differences and do those differences matter. And then I have another one that's kind of different here about PAs, emergency room PAs versus emergency room nurses. What are the differences in our jobs? All right, so if you're interested, check those videos out and I'll catch you next time.